Hello, welcome to Dr. G at the Heart of Healthcare. We have a community member here to talk about the road to an RCFE. We have Mr. Gus Fernandez, PharmD, administrator and owner of care home here. And so that's what we're going to talk about today. Welcome to the show.
Thank you much, Dr. G.
So
Glad to
glad
be
to
here.
have. Oh, thank you for joining me, everyone. So, the title today is Roadmap to the RCFEs, and RCFE stands for Residential Care Facility for the Elderly. I'm not sure if it has the same title in other states. I'll let Gus educate us on that as we have our conversation. But I wanted to cover this topic because we just came out of Assisted Living Week. Happy Assisted Living Week, Gus.
Thank you very much.
Thank you for having these places that are second to home when seniors or when ill people need a place to live and have full-time care. Thank you for providing that service to the community.
Our pleasure.
Yeah. And so you're in business with your wife. Shout out to Jennifer. Thank you for being here. This topic actually blossomed out of a conversation I had with her at one of our community events celebrating um, one of, what was it, Hospice of the North Coast, NOCO, they're being the best in North County. And so we started talking about this topic of when people need to get to an RCFE or get their loved one there, and how do they know when they should. So go ahead and just introduce yourself a little bit more, maybe
Oh,
outside
sure.
of
Oh,
this, and tell
absolutely.
us what you think about this topic.
Yeah, well, as a matter of background, once again, my name's Gus Fernandez, and I've got a doctorate in pharmacy and also a master's in business administration. From a career perspective, I started off working as a pharmacist. I worked at Kaiser Permanente and also a short stint at the VA Medical Center here in La Jolla. But the majority of my career was actually in the pharmaceutical industry. I spent many years working with large companies, medium companies, and even small biotechs. And so my role was quite varied, but it was predominantly in the sales and marketing arena. And I worked in the pharmaceutical industry up until around 2019, which is when I joined my wife Jennifer in senior care. 4 years prior to that, we had purchased a company called Senior Helpers, which provides in-home senior care. And right around the 2019, 2020 timeframe, we also got interested in residential care facilities for the elderly. The old moniker for that is also used as boarding care. And so we did our diligence for a couple of years. And in 2021, we ended up purchasing these three homes in La Jolla. So that just provides kind of a brief overview of my background and kind of what my experience has been.
Excellent. Well, thanks for being here. So when I talk to your wife, does she have a medical background?
Her main background is in the clinical trial sector. You know, she
Yes.
worked for many, many years in clinical trial recruiting, monitoring, et cetera.
Yeah, I could tell because she was so knowledgeable about everything we were discussing, and I could just sense her passion about this topic. But anyway, we were talking about how many times various adult children they find themselves in a situation where they need to find a place for their mom or their dad, sometimes brother, sister to live. They're getting discharged from the hospital. They need a place right away. And it's crisis mode. I see that as a physician, crisis mode. That's why I started this company so that I could consult with people to help educate them and understand the things that they need to know so that they can make informed decisions. And so, anyway, she mentioned that they need someone to hold their hand and educate them on the milestones of a disease. Like, when is it a good time to move your parent or your loved one out of their home and then into a boarding care, residential care facility, assisted living, all these different monikers that there are. And I told her, let's talk about it. So maybe you could share some of the things that you see are um, just maybe three or four things that people can take away to know when it's time. And I also want to note that these places are the next best thing to home. I've been in many of them. There's one actually a few doors down from my new house. Here in San Diego, and no one knows. I think the HOA knows, but if something comes up, I'm definitely going to advocate for it to be here because no one can tell that it's here and it's needed for seniors. So tell us some of the things you think are milestones or things people should look for when it's time to,
Oh, oh,
maybe select a RCFE.
oh, absolutely. And I gave a discussion last week at the La Jolla Rotary that was kind of similar to this discussion now. That discussion was based on options for senior care. And there are various kind of transition points that people take when they go through thinking about senior care for a loved one. As you mentioned, everyone likes to stay at home. And we provide caregiver services for those people who want to stay at home and can stay at home. But there comes a time, quite often, where people can't. And that's when the adult children or others who might have power of attorney come to make decisions. Are they candidates for a large assisted living community? And there are plenty of choices for those. Or do they want something a little more personalized, a little more boutique? And a lot of it comes down to two things. One is what kind of care do they need and how closely do they have to be observed? For example, in a larger community, you might have, for assisted living, that is, you might have one caregiver for about 8 or 9 residents. And that's adequate in that setting because these residents tend to be higher functioning. But there does become a time where you need a closer set of eyes on people. And that's where residential care facilities come in. We'll have anywhere from two caregivers during the day. We have wake staff at night, and we never take up more than 6 residents per house. That's what our license allows. So you get a lot of close attention to people for those people who need close attention.
That's fantastic. Um, Maybe we can talk about, obviously, there's high cost in healthcare. That's why people have a 401k. That's why they get long-term care insurance because they want to have a nest egg so that they're ready for this time of life. I don't think people talk about it like they should. Everyone just has their 401k over there. I guess they think they're going to be going on cruises. I don't know. And I'm not trying to make light of the situation, but there's a high cost of healthcare that many people are not prepared for because they haven't thought about what's going to happen when my health declines. I just bought, not me, but someone may buy their dream house when they're 50 or 60 years old and they're not considering, it's 3 stories. What's going to happen when they get weaker and they're not able to take the stairs? Are they going to be able to hire full-time caregivers to come into this dream home, or will they need to sell the home and move somewhere else? So there's a lot of factors that go into that. um, how would someone who's, I guess, navigating that even figure it out? Do the hospital administrators help them? Like where? I
Well,
don't
as
know.
you
I have no idea.
Well, as you mentioned earlier, when it comes to having to find assisted living or memory care, it usually comes up fairly quickly. A lot of times it happens unexpectedly. People do expect and want to stay in their home for the remainder of their lives. But sometimes things happen. Maybe there was an illness, maybe there was a fall, and all of a sudden they're faced with making a decision, like I mentioned a few minutes ago. Along with that decision comes how do we finance this? Some people do have long-term care insurance, but not everybody. And so for those who don't have long-term care insurance, they need to find other sources for funding because much of this is private pay, whether you're in an RCFE or whether you're a large community. And so that all comes into effect. Not many people plan on this because they plan on having the golden years of traveling and vacationing, et cetera. And it's hard to predict an illness or a significant event that's going to require you to go into a large community or a small home like ours.
Understood. We have that, but then also we have our really vulnerable seniors, right? They're in their 80s and 90s. And it's pretty obvious that, they shouldn't be left in their homes, and they need to be looked at a little more closely and maybe thrive in these smaller communities. Maybe their family lives in on the other side of the country in Boston, and they've always been independent. And so it's better for them to be in a place like this. I have a few patients like that where, the nurse will just update their family member on the other coast, every time they have a visit because there's no one around. And so I want to normalize this conversation so that people, you know, avoid the stigma of homes. We talked about this on a memory care episode, which is also an RCFE, everyone, where people have made a promise: I'm never going to put you in a home. I'm never going to, put you in a facility. However, these places are the next best thing to home, and they provide the caregiving necessary for people who are critically ill. Some are on hospice, some are just regular patients needing a mobile physician, but they need the care. I've seen patients with stage 4 ulcers because people insist on keeping them at home, and those people are not getting the care that they need once they're bedbound. And so, if you're listening and you're at a um, decision point, or someone in a decision point, I just want you to be open-minded, open your heart about what is available here. So could you tell us, like, are there a lot of boarding cares in California and the country? I don't really know the landscape. Could you share that with us?
Yeah, so there are quite a few RCFEs here in California. I'm not so sure about the other states. I don't have any specific number in mind, but there are quite a few, and that's good because people do have a choice. And as you mentioned, no one really wants to leave home. But if you are going to leave home, it's nice to have the opportunity to go to a home-like setting, because we kind of have the double benefit of a home-like setting, a lot of close eyes, but also, and this is to the benefit of everyone, we're very highly regulated. All of our homes are licensed. They're inspected by the state. We all adhere to Title 22, which is a full, dossier of regulations that we need to adhere to. We need to maintain compliance, et cetera. So you're getting kind of the double benefit of a small home-like atmosphere, but being rest assured that you really have the state of California on your side when it comes to being safe, protected, and well cared for.
That's good news. That's excellent news. Well, I'm going to put a link to some resources about RCFEs. Again, this one specifically, La Jolla Senior Care Homes, is a boarding care RCFE. We're also going to talk about an actual assisted living community, maybe a part of this episode, and we'll kind of attach it. And we'll continue to learn more about it. And I want to mention a previous episode where I spoke to Brenda Lee Smith. She's an Oasis Senior Care Advisor, and I answered my own question, actually, like how do people navigate this process? So I know she provides this service for a lot of folks. That's where we met initially. We met twice in a month, so,
Yes.
at a networking event with her. But she helps families navigate this process of finding the best place for them, the best place for their budget, and the best place, for the patient's needs. And so I thank you for that. So did you have any final words before we go? I get another sip of my coffee.
Uh, yeah, I think in terms of final words or recommendations, as I mentioned at my presentation last week, I think it's really important to be prepared and to kind of study the landscape because, as we mentioned, a lot of these events or decisions to put someone in a home, they come up quickly. And more often than not, a big part of what we do is we help counsel people, we show them options, we give recommendations, but it's also best if someone can educate themselves. The information's all over the internet. You can take a look at your various options for in-home care or your various options for having someone go to a community. And it won't take long to educate yourself, even maybe take the time to tour one or two communities, get an idea of how they function. And when that time comes, you'll be very prepared to make a decision.
Excellent. Well, thank you for being here. Um,
My pleasure, and thank you.
I got to give a shout out to my UCLA Bruins.
I see that.
Do you follow any football before we
I,
go?
I'm a big fan of NCAA football. Yes.
Who's your team before we go?
Well, I did my undergrad over at San Diego State, so I like the Aztecs. You
Okay,
know,
my
and
daughter's alumni.
yeah, well, and we hope their season gets better.
Yeah, yeah. Well, you guys, we beat you this time. I know you beat us
Yes,
last time when my daughter was there. It's so funny. Well, thank you for being here. We appreciate again the service that you provide to the community. And I want this show to highlight that so that people are educated about the things available for seniors and we're not in crisis mode when we're at these decision
absolutely.
points. So you have a wonderful afternoon
You
and
too,
thanks
Dr. G.
listeners. Thank
Thanks so
you.
much. Take care.
Peace everyone. Bye.